I'm Barbara Bartlick at the Integrative Healthcare Symposium in Manhattan, and I'm interviewing chiropractor Dr. Loren Marks, who has some very interesting new treatments for the knee that's very innovative that I haven't heard of before. Would you tell us about it, Loren?
Sure. Pleasure to have a conversation with you about it. So what we're doing is a decompression therapy for the knee, which creates a space in which degenerative and painful knee conditions get treated. And it's non-surgical, non-invasive procedures. And we're combining that with radial shockwave therapy, and we're getting great results. Synovial tissue in the joint becomes limited when the joint space becomes narrowed and the arthritic changes manifest, and there's decreased flexion and range of motion within the knee. So what we're doing is we're doing a combination of where we're creating space, and at the same time that allows hydration and new synovial fluid to rebathe the joint surfaces, creating a space, increasing the motion. And then we're using radial shockwave therapy because these conditions are chronic, and nothing works better for chronic than radial shockwave therapy because it stimulates a temporary inflammatory process to wake up the healing processes and allow the body tissues to then respond in kind by setting increased vasculature, decreased inflammation, increased ranges of motion that all get stimulated. In essence, they're doing a healing reset rather than the matted down, tight, restricted, painful joints that typically exist with these arthritic and degenerative changes. And the best part is it's non-surgical and it's non-invasive.
Yeah, and so many of these people are being referred for knee replacement, and maybe they don't need it. Maybe they should try something like this before they go to that.
It's true. Look, there are certain cases where the joint is too far gone, and those people do need surgical intervention, but there's so many people that don't. And this is that window of time and space where an intervention like this can actually make the difference and improve the quality of life and have your joints work better and get your ambulatory capacity functioning again.
So you're combining these two therapies. I haven't heard of anybody doing that. I've heard of the sound therapy for the joint problems. We also use it in sex therapy for erectile disorder and also for female sexual dysfunction. On the same principle you mentioned, that it creates a bit of inflammation, and then there's healing that comes in. Yeah.
Right.
So
it's extracorporeal shock-wave therapy in essence.
Yeah. You know, that you're combining these two things. It's a great technique.
Well, you know, multimodal applications work better than singular in cases of chronicity.
Absolutely. Well, Loren, thank you so much for sharing this with us. I think it's very important.
You're welcome.
And a lot of people should look into it. So good to see you again.
It's a pleasure. Thank you.
All right.
All right.